Hello and welcome to the Counterpoint podcast. I am joined today by Ankit Malhotra and Yang Wang. And we're going to be talking about wearables, health, fitness, and all of that. So 2020 has been an interesting year, you could say. We've been suffering through a global pandemic, and that continues. And I think that has accentuated a lot of people's focus on health and wellness, and also how healthcare systems work. And the role of wearables perhaps has come into even more focus than it has before. Now, we've been tracking the smartphone market and the IoT sector for a long time. And smartphone makers are increasingly focusing on the health and fitness-centric products as part of their IoT strategy. So we see companies like Apple with Apple Watch, but also Samsung with its range of smartwatches, Huawei, Xiaomi, and others, developing fitness bands and watches. And these join the likes of Garmin, Fitbit, Goki out of India, and many others. So there's this sort of growing groundswell of devices, but also services that are beginning to come through to help users stay fit and healthy. So let's get into a bit of discussion here. So Ankit, hello. Yang, hello. How are you today?
Hi Peter, how are you? I'm doing fine.
Great. Yang, you good? I saw you on Strava earlier.
Thanks, Peter. I hope you had a good run. And also nice to meet you, Ankit.
Yeah, nice meeting you too. Yeah.
So yeah, for listeners, we're kind of spread around the world. So Ankit's in India, just outside Delhi, and Yang, you're in Hong Kong. So we're going to bring kind of different perspectives on this, and so let's get into the discussion here. So if I can turn to you first, Ankit. So thinking about the wearables market, obviously we've got smartwatches and wrist-based trackers, but can you kind of expand a little bit on the the different types of devices that we've seen and that we track in our sales tracking?
So wearables are anything that you can wear on your body and they, do a function. They complete a function. It could be from earphones to fitness bands to smartwatches. But today, in the context of health and fitness, we're going to be more talking about fitness bands and smartwatches. Out of the two, fitness bands are usually more simple. They can track steps, track heart rate, and they're little bands, just like we say fitness bands. Smartwatches are a little more complex. They are a little like a computer. They have processors. They have connectivity. You can use it as your phone. You can use it in place of your phone, and so on. So those are two different kinds of wearables, and they have different functions. Usually, you see bands are a little cheaper in compared to smartwatches, and there are two types of wearables.
Okay. So I mean, I've been using athletic orientated watches, I guess I could call them that, for many years. So what's changed? Yang, if I can turn to you. So why why do wearables have this sort of unique ability to fulfill fitness centric functions?
Well, if you look at fitness tracking devices, as we refer to them, we're talking about gadgets with basic features like a step counter, heart monitor, calorie monitor, exercise tracker, or sleep monitor, etc. Now, when back in the day these devices first emerged, they existed as individual devices, so each of them tracking an individual fitness category. So back then you would have a pedometer, a heart monitor, a calorie counter, etc. Now, what happened in recent years was that these have all evolved into all-in-one devices, most popular obviously being a smartwatch. Now, this all-in-one development is quite important because think about it, it will be pretty crazy to expect someone with all those individual trackers that I had mentioned on simultaneously, right? Except maybe if you are a professional athlete. Now, when you put all these factors together, we think that the wristwear category, smartwatches and bands, um, are the least intrusive of all form factors. Now, this form factor is acceptable to most people because watches have been around for a long time. So, what this means is people would be more willing to have smartwatches or bands on for most of the time. Now, this increase in duration of tracking improves the quality of data being tracked, whether you are doing an activity or not. And in return, this gives the user the incentive to wear these smartwatches even more. And you can see this creates a virtuous cycle for both the companies and for the users. Now, if you add connectivity features in these gadgets, where they are connected to apps on smartphones or the internet, you will have additional dimensions such as gamification in terms of, let's say, achieving a predetermined fitness goal, or social. Now, that will be in terms of sharing fitness activities with others. And eventually, you can see long term health benefits will start to being unlocked.
So if maybe I can kind of push back a little bit, and if I look at my kids and my kids' friends, I mean, I have 3 kids ranging in ages from 14 to 28 years of age. None of them wear watches, and none of their friends wear watches. It's just not something that the youngsters seem to do. So, is that a potential kind of time bomb under the wearables category, or do you think that over time, as they kind of reach a level of maturity and start to want to track their activities, that they may adopt wearable devices? Or put it, if I can sort of throw in another wearable type device, and Ankit actually kind of mentioned hearables. So hearable devices actually, or devices that go in your ears, maybe they're hearables, probably they are, but they actually can track some biomarkers better than wrist-based ones. So they're actually better at tracking things like pulse and blood oxygenation and even blood pressure, better than wrist-based ones. So do you want to kind of talk to those points a little bit?
So, well, I don't have kids for now, so I'm only guessing, putting myself in their shoes. And I think you're correct in saying that, these wearables probably haven't been as popular to younger age people. I think that would be natural because health and wellness would probably not rank very high in terms of needs for youngsters in terms of their consideration for their next gadgets. If they were looking for a second screen other than their smartphones, then wearables will probably not rank very high on their needs. But on the other hand, as they grow older and as they enter adult life and experience some of the problems that we working professionals face every day, then I think from a wealth and health point of view, they will start to when they start to look at these potential issues more seriously, then they would be in a position to look for these fitness trackers or health trackers. So I think you're absolutely correct. Maybe we're still in the nascent stages of wearables as a sector in the tech industry. There's certainly something the companies can think about in terms of producing form factors or features or connectivity that may attract to younger aged audiences.
Okay, it's maybe a good point to which to move to Ankit, because I think we can potentially say that wearables have helped people over the last few years to kind of track their activities, and I know we've had a sort of a bit of a conversation where, there's a perspective that wearables will actually help people, actually help save lives. And I think, if you look at, for example, Apple's introduction of, being able to identify atrial fibrillation, there's many cases where people have not known that they had that issue and have, seen it on the Apple Watch and have then gone and had follow-up medical intervention, which has potentially saved their life. So, thinking about this maybe from more of a healthcare perspective, what do we think there? So we have, on the one hand, we have the sort of health and fitness or health and wellness, but then healthcare, which is a, more of a medical perspective. What's your perspective on that, Ankit?
When we talk about health on wearables, this is one thing that differentiates wearables from smartphones. We have seen that people who are buying wearables, be it any fitness band or smartwatches, they already have smartphones. So when you have to make sure that uh, fitness bands or smartwatches reach a lot of people, then you have to give out a benefit that smartphones cannot offer. Some people, yes, some people for technology enthusiasts may buy without any additional benefit. But if you want mass adoption, you have to give something additional that your smartphone doesn't offer. For example, I started using this mi band in the pandemic to monitor my sleep, because when the pandemic started, daily routines went haywire, and I wanted to figure out how much I was sleeping regularly or not. So I bought this band just to monitor my sleep, and that was an added benefit that my smartphone didn't give me. And like that, many smartwatches and fitness bands are coming up with different features. For example, there was a gentleman in USA. He was mountain biking in a remote area, and then he had a fall. He slipped, but the Apple Watch that he had detected a hard fall and notified his emergency contact that this guy had a hard fall at this area. And then the emergency contact called 911, and he was rescued. So in a way, that smartwatch saved his life. Another example, a man in Indore, India, as you know, Apple Watch again has an ECG feature. So Apple ECG takes your ECG twice or thrice a day. And he noticed that his heartbeats were getting a little irregular, even though he didn't have a heart problem. So when he consulted his doctor, a doctor said that, yes, you must have a surgery, and he had a surgery, and that saved his life. In a way, we can easily see how regular monitoring, regular surveillance of your body, of your critical conditions, critical KPIs of your body can help save your lives.
Yeah. Okay. And I think, as I said in the introduction, the pandemic that, we're living through right now has acutely increased people's awareness of, how that they, how their health is under threat, and that, actually monitoring health can help. So, turning back to you, Yang, I mean, certainly in the kind of acute cases of COVID-19, something which many doctors have identified is that people are sometimes unaware that they're as sick as they are, because they essentially have a pneumonia situation, but the body is quite good at kind of disguising it. But actually, when they put them on a blood oxygenation monitor, they see their oxygen levels are really quite low. Can you kind of expand a bit on this, and how wearables can be used in a context to sort of track both the fitness, but also the underlying kind of wellness of people?
Yeah, I think in terms of general fitness, at least in the developed world, there has been noticeable um, increase in awareness and improvement of people's health conditions since the pandemic started, purely because people realized that they were not living as healthily, that even if they were healthy, they wanted to make sure that they were on a good physical and mental trajectory, and simply as people exercised more. So we have evidence from companies like MyZone, which is a fitness tracking app that converts workouts into points based on intensity and duration. So they found users have been earning an average of almost 20% more monthly points since April versus a year earlier. And interestingly, the biggest increase has been in the over 55 age group. Um, Similarly, you have Fitbit, which is also a fitness wearable and tracker company that monitors heart rate and sleep patterns. They also found that the resting heart rates slowed in early months of lockdown across the US. Now, this actually means a fitter population throughout. So I think there are three factors at play here that's leading to this improvement. Firstly, many more people in the developed world have been working at home. Their patterns have been disrupted. But on the other hand, this means less time is spent on commute, socializing, and entertainment. Um, so people have, on the other hand, found more time for exercise, especially as we have been mentioned. Especially as we've been mentioning, increasing awareness of COVID's effects, especially for unfit groups. Secondly, due to lockdown measures in some parts of the world, indoor activities like gym and team sports have been banned. Now, in some places, people were allowed out only for essential shopping and exercise. So naturally, people found, getting a fitness tracking device like a smartwatch was the best way to plan and track their maybe 1 hour per day run or cycle or walk in the park. Lastly, from a psychological point of view, staying fit really requires frequent exercise, and what prevents people from exercising more is loss of motivation from a perceived lack of progress. Now, fitness devices and apps do a great job of quantitating, qualitating, and visualizing performance and progress, which I would say is a very sweet psychological candy for people to do more.
Yeah, I mean, one of my friends who's very active on Strava. I mean, she rides a bike a lot, and when she gets home, the first thing she does, even before she's put her bike away, is to upload the bike ride to Strava. And if she's not getting kudos, which is a kind of a like on Strava, if she's not getting kudos within like minutes, she's worrying, what's happened. So that psychological candy really is, a big motivator for her. So these wearable devices and associated services can be a great way of helping people to stay fit. So that's a kind of a strong use case. But coming back on this issue of how to really kind of leverage that data coming out of wearables. So Ankit, if I can turn to you, can you? I think you've done some sort of research on some of the companies that are using this data, using this capability to build new service revenue opportunities. Can you talk to that a bit?
Yeah, sure, Peter. So, what we have seen that, as we have mentioned before, with wearables, you not only get the opportunity to sell a hardware, you can also get an opportunity to sell services. People buy wearables to get more fit, to have lead a better life, and they just cannot do that. Sometimes they need guidance. So many companies are providing that kind of guidance. For example, we have many cases. Number one is Apple Fitness Plus. I think they have their plans from around $10 a month or $80 a year. We have a Fitbit Premium Plus health coaching. I think Yang can also tell us about a premium Fitbit premium fitness plan. But I would like to point to one more point, that when we have services, that means the OEMs can earn revenue from from a particular product for its entire life cycle. Unlike any other product for which only you can only charge for hardware, from wearables, if you have services enabled, you can earn for the entire life cycle, which can which can in turn bring the entry point, that is the hardware cost, lower for the consumer, which I think can again bring attract more people into the ecosystem, attract more people who are using these kind of wearables, and increase the attachment rate and increase the number of people who in fact can get fitter by using these uh, wearables. So Yang, if you can talk about those plans.
Yes, certainly. So obviously, a lot of companies are looking at these channels to gain additional service revenues. Um, so as you have already mentioned, Apple Fitness Plus monthly subscription, which includes workout programs by top trainers, and these programs are refreshed every week to make sure you're hooked to them. And of course, Fitness Premium Plus health coaching. So this has the added benefit of one-on-one coaching and customized training plan. And then there's a company called Whoop in the US, which has which was favored by professional athletes like LeBron James and Kevin Durant of the NBA, and Justin Thomas, who is the world's #1 golfer. Now, Whoop offers even more complete and granular health metrics tracking with daily reporting. So you're looking at a very niche group of athletes or enthusiasts, and they are group programs for like-minded, really we call them hardcore fitness enthusiasts. So in general, I think these are examples where um, platforms owned by wearable hardware companies, think about innovation to boost their offerings. But I think, on the other hand, hardware companies can do more by enriching their existing platforms ecosystem by bringing on-demand content from other companies like Sufferist, Training Peaks, or Strava. So these are companies that have high quality fitness programs designed by really influential sports scientists, but they lack a platform with a large user base. So clearly, I can see a potential synergy between these, on-demand content providers and the hardware companies with a platform.
Okay, yeah. I mean, I think there's a lot in there. But I think we've talked here a lot about, I think, probably more about the health and fitness or health and wellness aspect, and maybe less about the Medicare or healthcare aspect. So maybe as before we conclude, I think, Ankit, you had an example from Singapore, which maybe gives us some insight into how wearable devices can support maybe that more sort of basic healthcare aspects. Can you expand a bit on that, Ankit?
Sure, Peter. So we have talked about how individuals can improve their health, can improve their fitness by using these wearables. But this, I think, is the first example where we can see a large scale model where people can improve their health by using a wearable and where the government is involved. In September, the Singapore government and Apple reached a partnership and launched a program called Lumi Health. What Lumi Health does is that they have an app that can only be used on Apple Watch OS 6 and above. And when you use it, you have daily tasks like you have to sleep regularly. What you eat is monitored. How much activities you have, how much you walk in a day, how much you run, how much you exercise. All that is monitored, all that is stored. On that you get daily personalized recommendations, daily personalized coaching, and in the end you also have a chance to win around 300 to $400 uh, in in health in health coupons that is sponsored by the Singapore government. uh, as of and this program was started in late of October. The app was available, and at the moment, as I can see, it is number 3 in health and fitness on the Apple App Store. The ratings are not that good. 3.4 ratings are the rating of 3.4, but most of the reviews that I have read, The people who have given low reviews are those people who haven't been able to sign in, or have faced technical difficulties. But overall, this is just a start, and it bodes well. Also for Apple, there's a lot of talk of data privacy, and people are concerned where their data is being stored. Apple can use this as a PR and make people understand that if a government can trust Apple with the data of so many users, then ordinary users can also trust Apple with their data.
Yeah, I mean, I think the whole kind of data privacy thing is, is clearly going to be an important factor here, but maybe beyond the scope of this podcast. But I think the central point of that, which is providing a sort of a point system to support people in making healthy choices, is interesting. And there's clearly an incentive in the Singapore government in keeping the population healthy, not least because they will be less of a burden on the health care system. And I think my final point would be that if we look at, for example, the USA, where we have a largely privatized healthcare system, which is where insurance companies are heavily involved. It's the insurance companies who are also interested in helping people to stay healthy, and they have for a long time supported in things like nutrition. And here, again, there is this potential to use wearable devices to encourage people to, make healthy choices and then track what they, how they do in that. I don't want to say necessarily kind of track their compliance, but that's essentially ultimately what it boils down to. But guys, this has been a fascinating discussion. I think there's a huge amount more that we could talk about, but probably a good point to wrap up. So, Ankit, thank you very much. Yang, thanks very much for joining today. Have a great rest of your day. And for everyone listening, we hope you've enjoyed this. And if you want to find out more from Counterpoint's analysts, please check back for the next installment of the Counterpoint podcast. Thanks. Have a great day.